Well, we normally talk about COVID with you, but right now we want to talk about the crisis that seems to be unfolding in ICUs, not just in Ontario, but across the country. What is the current situation like at your hospital?
It's not just ICUs, it's ICUs, Emerge, it's the entire hospital, not just at mine, but across the province and really, I think, across the country. But what we're seeing right now is essentially our healthcare system failing a stress test, is how I've heard it best put. And yes, the healthcare system was in turmoil before the pandemic, and then this has just continued to worsen. It's difficult to get staff. It's difficult to have staff who are already working to continue to work because everybody's burnt out. And really, we're scraping the bottom of the barrel in terms of reserve right now.
So I've asked this question before, and maybe you can help me understand it. It's been 2 years since the pandemic. So where was the foresight to realize that medical staff were likely going to be burned out with all that they had to deal with? Because to your point, this was a problem before COVID, and COVID exacerbated it. So why weren't people being trained in these last 2 years?
I can't answer why people weren't being trained in the past 2 years, but I can tell you that there isn't enough funding to do that training. There isn't enough funding to actually keep people within healthcare. You can only do so much at work and be abused so much, yes, quite literally at work, but also with people protesting all healthcare workers last year, with outrageous hours for healthcare. There's no retention strategy. Right. There's very little training strategy, and there also hasn't been for give or take 15 or 20 years, which has only been made worse by the pandemic and made worse by really a lot of misuse of a lot of the funds that have been coming into the healthcare system in Ontario over the course of the past year or two.
Okay, give me an example of misuse.
So you hear all these rumors of money that's been given to the provincial government, for instance, to help prop up the healthcare system that's gone unused. And that's rather disappointing to hear, given the fact that nurses' wages haven't been rising with the rate of inflation. Because of that, I think it's Bill 124, or even looking at, as I've said, retention strategies I think are very important, but also hiring strategies. And although I think that it's very important to have a way for internationally trained nurses and physicians and other healthcare workers to be able to find a place within our healthcare system, being able to keep people here, I think, is more important.
Interesting. Is it hyperbole to say it's like you're at the Alamo, you're waiting for the cavalry, and no cavalry's coming?
Yeah, and that's what it's been like for the past several years. I went right at the very beginning of the pandemic. I had a lot of very positive conversations with the people that I work with and the people that have supported me throughout all of this, saying that we were all very concerned about what was to come if this pandemic got out of control, which it really has, and the help really hasn't come. We haven't been able to train extra people. We've lost people, and also that get up and go and teamwork spirit that I think we all had in March of 2020 has long since dissipated. We're tired of being abused, and I think that a lot of people really have left the industry because there isn't that strength in numbers that we used to have, and the people that are remaining can't do the job that they want to be able to do, and that hurts. It hurts people, it hurts our patients, and it makes us feel awful.
Dr. Dale Kalina is an infectious diseases physician at Joseph Brand Hospital. Thanks for your time today, Doctor.
Thanks, Jim.